Hello, and welcome back to Designing Care on Air. This is Elizabeth Johnson from Montana State University. One of the key pinnacles here at Montana State and many design programs and nursing programs is to help infuse clinical voice in the design of our built environment. Not only do patients experience these healthcare encounters, but providers do as well. And taking care of our caregivers is at the bedrock of Bobcat nursing. Amanda Stone, who is a DNP student here at Montana State for psychiatric mental health nurse practitioner, was one of our students who did the PDC Summit Student Design Competition this year at ASHE. Amanda, we're so happy to have you on Designing Care on Air today.
I'm so happy to be here. Thank you.
So you were the sole DNP student on the team this year. I would love to hear a little bit about what interested you into being part of one of the teams this year.
I was interested in learning how to, I guess there's multiple things. I guess I've always been interested in how systems work, especially healthcare systems, why things are laid out the way that they are. And I thought that would be a great opportunity to kind of get my foot in the door and to figure out how things are the way that they are. So working with architects and construction engineers and mechanical engineers and figuring out, okay, why does that need to be here? Because as a nurse working in the built environment, you are on the end product. So sometimes you don't understand that. And so I thought it would be a great opportunity. And then the other reason why I wanted to join was just being able to practice my, interprofessional skills and being able to learn how to communicate just to a broader scope of people that I will work with as possibly, a DNP in the future, wherever that degree takes me.
So you talked about the interprofessional part. I mean, you guys were given just 48 to 72 hours to put together a facility for nurses, essentially for wellness. That must have been a high pressure situation. So how did you guys create that interprofessional work? Was it challenging? Were there some parts where you found it to be most successful? How did you make it work?
Yeah, there were parts that were definitely challenging, parts that really drive. But I think just making sure to openly communicate. And then if there was a problem that did arise, I kind of go back to what I remember, make it about you when you approach a conversation. Don't be accusatory. Just be like, hey, I have some questions and concerns. I noticed that perhaps I'm not speaking clearly. Help me understand how I can better communicate to everybody else. And so when I noticed that there was a challenge amongst my group about approaching the topic at hand and making sure we were all on the same page, just kind of, getting in there and tackling it.
Right. And did you feel that this was kind of a bit more of a personal challenge, given the fact that it was nurses? Did that kind of add to the pressure, if you will?
Yeah, I felt like there was a little bit more of a personal challenge, like, oh, I want to make this good. Yeah, for sure.
And what design elements did you feel were more critical, since you are a nurse, you're turning into this advanced practice nurse. So you have that systems level view. What design elements did you feel were most important to bring through your final product?
I really wanted to make sure that if we were going to design something, that it flowed well, that it made sense. Like if we were going to put something in one area, that it was practical and that it was useful to, because these were nurses that were coming off their shift or before their shift, and they don't want to be inconvenienced by something. We wanted it, perhaps where they came from, there was inconvenience there. So I just wanted it to flow really well And I challenged my group members to think like that, like, oh, that looks really nice there, but help me like walk through this space with me. Like if you were a nurse and walk through and like come into this space with me. And like, if the door shuts here and opens like this, is this going to be practical? And if the chair's here and the lights are like this, how does it feel?
Yeah. And I like this idea of feeling, because I think that's where I don't know how you feel, but as a nurse, sometimes that's one of our first indicators of burnout is that numb feeling, right? So I noticed in your final product, you had a lot of tactile touch and feeling evoked that you wanted. So tell me a little bit about some of your favorite design choices that you felt that you helped influence.
I really like bringing the outside in, and the idea behind it was we're kind of overstimulated within our environment, the built environment within the hospital or in the clinic. And so we kind of wanted to bring in a more calming environment, but being able to reground people. So having nature. I'm trying to remember if we had any of the textures on the wall, and I can't remember if we did. We had that big living space in the middle with the water feature and
a lot of wood.
Yeah, we had a lot of warm wood and soft lighting to create just kind of more of a calming environment, which the idea, because that centered around the theme, like the nursing theory that I had picked, or the theory that I had picked, which was to kind of reduce our stimulus in that environment and kind of recenter us, and then, let us regrow. That's kind of where we picked more of the softwood.
And for the listeners, what do you remember the name of that theory?
It's called the attention restoration theory.
So tell me a little bit about that, because that was very popular among the judging group.
So there's 4 main principles to it. It's being away from being overstimulated and then creating the low stimuli. So creating like effortless attention. So if you walk into a room, just a low stimulus environment, something that like catches your eye without being like too much, and then reconnecting with your environment and finding some place that engages you, and then restoring your sense of self in that environment and in your sense of a person. Those are kind of the 4 main principles of it.
And it sounds like that really spoke to you on the nursing perspective then.
It did. I think I picked this one because when I've walked into hospitals and I've walked into clinics, and it's just too much. And having, experienced caregiver burnout, if I walk into a clinic and there's music blaring and there's kids screaming and there's colors going all over the place, it's just too much. And that's the last thing I want if I'm trying to, recenter myself or restore my sense of purpose, or if I'm trying to reground myself, that's the last thing I want, to go relax. That was kind of why I picked this, is to try to recreating a restorative environment.
So going off of, you've got this background that you're going to be this future psych mental health nurse practitioner. You've got these amazing ideas about restoration and the significance of built environment. What's next? Where do you see yourself taking this experience? Will you see it reflected in your practice?
Yeah, I'd like to think that I'll take this experience into my practice, and whether I open my own practice in the future, I can take this into designing my own practice, or if I work for an organization and they want help building new things and new systems and meeting patient outcomes and quality metrics, and they want to identify why things aren't being met, just being able to identify and help them identify, like, hey, let's take a step back and look at this, and being able to effectively communicate with a wide variety of patients or professions who don't all speak the same language.
Wonderful. And what did you find were the takeaways with, learning the architecture world and construction and engineering? Were there any surprises for you?
It was very insightful. I think in my past experience, I had the opportunity to work with some engineers in the past, mechanical and electrical engineers. And so I kind of understood their language, but I hadn't had the opportunity to work with an architectural group before or an architectural student. So I just appreciated the opportunity to really work on effective communication and learning how to speak their language in an effective way.
And I know one thing that we really work on is also effectively communicating our environment, right? So rural, non-urban care. The charrette that you guys had was based out of Phoenix, very, very urban, lots of resources placed on this. What are some design challenges that you feel we face in rural that will definitely need that nursing voice?
Yeah, you bring up a great point because we literally had everything in our fingertips in the urban environment. And in a rural community, we don't really have all of those at our fingertips. And so being able to, if you work with people in the future, being able to explain that and get them to think outside of the box and having this experience, knowing how to use the available resources in the rural community is really important. And accessing what resources you have.
So what do you see are some of the hair on fire design challenges that you've seen in rural hospitals that you'd really like people to know and think about when they're coming in, if they're an architect, for example?
It doesn't have to look pretty. It just has to be functional. And when we're as nurses in the patient's room, it's all about practicality and providing the best patient care. Most patients, they like certain things in the room, but for them, it's about practicality and the functionality of the room. They're not really focusing on light fixtures and the way that the lights look and what the casing of the light is. They want to make sure that the light reaches them and the nurse and it's not blinding them at eye level. They don't need to have a glass staircase.
And what do you feel would be really, obviously the charrette was about nurse burnout, nurse retention. What are some design items that you feel would really help with nurse retention and decrease burnout just on a daily basis in rural areas?
I think one of the things I've experienced is just having the access to certain things in the hospital. So if I'm charting, having the ability to chart in the patient's room, but not having to fight with the computer, or having a chair to sit in and not wandering around looking for a chair. And, if we have a med room, making sure that med room is actually closed off from everybody else and you're not distracted.
So it sounds like really just going back to basics, right? Decreasing our distraction, making sure we have, like you talked about, resources on hand. Some of the other things that I've heard from other rural nurses include just natural light. And then on the behavioral health side, that pretty much every patient room is now a behavioral health room. Do you find you'd agree with that as well as you're going through your clinicals?
Yeah. The natural light, some of these rooms, they have these little, their blinds are broken. And so their blinds are always shut, or they don't have a window.
Right. And that's something that we keep chronically hearing. And that was something that we saw a lot in your design, was this open access, open light, to give us something that honestly shouldn't be a treat, but can be a treat to nurses. And I hope that changes.
Yeah, I actually read a research study that said that people, it was specific to patients that had a CABG. The patients that were exposed to light following their CABG were able to discharge from the hospital, I think it was 1 day sooner.
It's incredible how going back to basics can really be the true cure, the true medicine. And that goes both ways, right? For patient and provider, that maybe that would help with retention as well. Just even being able to have access to light, same as it helps our patients. We've also seen, just to echo off of your CABG, with delirium, decreases of delirium, just a natural light, and having that Cadian light, systems. So completely agree and loved to see that in your design. So before we conclude today, do you have any other thoughts or key takeaways or advice to students or to people who are sponsoring these types of charrettes or thinking about sponsoring them? Do you feel it was worth it? Would you recommend it?
Yeah, I think it was totally worth it. It was a great 72-hour event. I learned so much personally about myself and about healthcare design. It was such a phenomenal opportunity. I'm so glad it's out there. And thank you for the opportunity. And I'm so glad that we were able to go there and experience it. And I tell everybody about it. Oh, I did this. You should know all about it. And it's such a great opportunity. And I wish, I'm so glad that nurses have been involved for a while. And I'm glad we're able to continue to be.
Excellent. Thank you so much, Amanda. And for our listeners, so the PDC Summit is one of the larger charrettes. Of course, we have one for the HCD Expo as well. But Amanda's story, much like the other stories that you heard just from Montana State University, show the hunger and the need to have more design awareness, to infuse that clinical voice, and beginning that interdisciplinary work and education early. So we appreciate very much those who are sponsoring or thinking about sponsoring these types of charrettes and events, because they truly do impact patient outcomes, provider shortage, decreasing those, and overall touching all of our lives as healthcare design does. This is Elizabeth Johnson for Designing Care on Air. We'll see you next time.